Hey everyone! So for our discovery project, we decided to focus on Tourette syndrome, which is a subtype of hyperkinetic dysarthria.
Tourette syndrome results in brief involuntary movements, sounds, or purposeful movements. Vocal tics can occur in isolation or within verbal utterances, and simple tics are repetitive in nature. This type of dysarthria is unique because specific sounds or words represent the disorder.
On this slide, we've included a video link to the neuroscience of Tourette syndrome, which is extremely interesting. A quick synopsis on that. Basically, Tourette syndrome is characterized by recurrent involuntary movements or sounds called tics. And these tics can be classified as either simple or complex. So simple tics actually involve only one group of muscles and might consist of actions like eye blinking or throat clearing, whereas complex tics are more elaborate and might involve actions like reaching out to touch something or the involuntary use of obscene language, and that's known as coprolalia. So the neuroscience of Tourette syndrome is not fully understood, but many studies suggest that an important role exists for a group of structures known as the basal ganglia. And as we know, that includes the caudate, putamen, globus pallidus, substantia nigra, and subthalamic nucleus. The impact on speech is important to consider here. As I mentioned earlier, there are verbal tics and phonic tics. So that includes repeating one's phrases, one's words, repeating others' words or phrases, which is called echolalia. And of course, coprolalia is the use of vulgar or obscene words. Phonic tics include sniffling, throat clearing, blowing, coughing, echolalia, as well as coprolalia.
When assessing the tics associated with Tourette syndrome, it can be challenging due to their difficult nature. It is important to take interviews, clinical examination, and reports by families and friends into consideration. The Yale Global Tic Severity Scale is the standard to measuring tic severity. We have included a small portion of the scale. If you are interested in the entire scale, there is a link provided. Habit reversal training is the most researched technique for Tourette syndrome. One component of the training is awareness training, which is when the patient becomes more aware of the presence of the tic. The tic is monitored closely, and mirrors can be used during this to create an increase in patient awareness. Competing response training is another component which helps the patient learn to initiate a response in place of the urge to perform a tic. Habit reversal training has been effective in multiple randomized controlled trials for reducing tic symptom severity and tic related impairment through awareness training and competing response training.
A second therapy approach that we've added is the comprehensive behavioral intervention for tics, or CBIT. And this is an evidence-based approach to behavioral therapy for Tourette syndrome and chronic tic disorders. Similar to HRT, this includes every aspect of habit reversal. It just has a few new elements, which would be the education aspect as well as new relaxation techniques. And CBIT has been shown to be effective at reducing tic symptoms as well as tic-related impairments among both children and adults. And so the primary difference is that as the clinician is using CBIT, they would work with the child to better gauge the types of tics and understand the situations in which the tics are triggered. And so by changing the surroundings, if possible, the person with Tourette syndrome will also use a new behavior instead of that tic. And that goes back to habit reversal. So according to a recent study, CBIT actually normalizes or at least reduces the increased binding between perception and action. And as a result, This increases the ability to perform response inhibition. As I mentioned in the previous slide, CBIT uses core HRT skills in addition to relaxation training, behavioral rewards, and functional assessments, as well as function-based interventions. And that would actually allow for the mitigation of daily life factors that can exacerbate tic symptoms. So, two primary benefits of CBIT are that it's consistently demonstrated to be effective at just as HRT was in randomized controlled trials. And it's also more comprehensive as far as behavioral therapy goes. When considering the role of the SLP in the treatment of hyperkinetic dysarthria seen in Tourette syndrome, it's important to understand that we don't provide therapy for tics. So, treatment for tics is actually provided by a number of other professionals, such as counselors, psychologists, psychiatrists, social workers, as well as physicians. However, we are responsible for managing other difficulties. So, of course, this extends to pragmatics, understanding topic maintenance, turn taking, conversation, skills that we need to form successful relationships in not only schools, but also in social and work environments. We would also provide therapy for articulation, stuttering, and other motor speech disorders. Importantly, we could use the techniques mentioned earlier in the presentation, HRT and CBIT, to behaviorally manage these tics.
Thank you for listening.
We hope you enjoyed learning more about Tourette syndrome and the therapy approaches used to treat it.